Assalamualaikum warahmatullahi wabarakatuh. We are from Group 3. We'll be presenting about cardiovascular system. What is cardiovascular system? Cardiovascular system consists of a heart and closed system of vessels called arteries, veins, and capillaries. The function of cardiovascular system is to pump blood and supply oxygen from the lung to the rest of the body. My name is FAHMI bin FUAD. I will explain about coronary artery disease. First of all, what are the part of organ or the organ from the system that affected by the coronary artery disease? Coronary artery disease affects our heart. It is a narrowing of coronary arteries that prevent adequate blood supply to the heart muscle. Usually, this caused by the arteriosclerosis. It may progress to the point where the heart muscle is damaged due to the lack of blood supply. Next, what the function of the system and how it's affected by coronary artery disease. When coronary arteries struggle to supply the heart with enough blood, oxygen and nutrients, it will cause many problems such as first, angina pectoris, which is a type of chest pain caused by reduced blood flow to the heart. Next, a heart attack or myocardial infarction that happens when one or more areas of the heart muscle don't get enough oxygen. This happens when blood flow to the heart is blocked. Lastly, ECG change due to the acute coronary syndromes. Without a treatment, this blockage can cause permanent heart damage, and ECG can reveal a sign to the syndrome and any associated heart damage. Let's proceed to the risk factors leading to the coronary artery disease. First, study shows a direct link between cigarette smoking and coronary heart disease. Smoking, including during the teenage years, increased the risk of dying from coronary artery disease. Next, hypertension, or in other words, high blood pressure, is a common condition in which the long-term force of the blood against your artery walls is high enough that it may eventually cause health problems such as heart disease. This factor is related to the next factor, which is the high blood cholesterol level. Excessive cholesterol will block the coronary artery, causing the hypertension. Lastly, coronary artery disease (CAD) is a major determinant of the long-term prognosis among patients with diabetes mellitus. Lastly, what is the available treatment for coronary artery disease? First treatment is called angioplasty and stent placement. The placement of stent inside the coronary artery helps keep it open to increase the blood flow. The second treatment is coronary artery bypass surgery. A graft is created to bypass blocked coronary arteries using a vessel from another part of the body, allowing blood flow around the blocked or narrowed coronary artery.
Alright, let's move on with our next disease. We have cardiomyopathy. So what is cardiomyopathy? It is when the heart muscle weakens and is unable to pump blood to the rest of the body as well as it should, which is going to lead to irregular heartbeat, heart failure, heart valve problem, or other complications of organ that are affected by the cardiomyopathy disease. Okay, I prepared 3 examples. Okay, first of all, we have dilated cardiomyopathy. As you can see from the picture I prepared here, the ventricle is a little bit bloated. So this disease affects the heart muscle tissues at our ventricle. So the dilation occurs on one or both ventricles of our hearts. So what happened once the ventricle is dilated is the weakened heart muscle will not able to pump up the blood efficiently, which will not able to deliver enough oxygen to the organs that need it. The next example I prepared here, we have hypertrophic cardiomyopathy. So this is where the heart muscle is thickened and it's causing the ejection fraction of blood decreases. At the ventricles, you see the muscle there is quite thick. This will cause the volume of the blood that entering the ventricles will be decreased. And last but not least, the example that I prepared, we have restrictive cardiomyopathy. So as you can see from the picture, the walls of the heart lower chamber at ventricles will become unusually tight and lack of flexibility to expand when the ventricle fills with blood. So it will be very rigid. System and how affected cardiomyopathy disease, we have the heart muscle weakens and is unable to pump the blood to the rest of the body as well as it should, backup of the blood into the lungs, or atrial fibrillation, which can lead to blood clots, stroke, or other heart-related complications. So as for the heart muscle weakens and is unable to pump up the blood to the rest of the body as well as it should, as I said, where the heart muscles become rigid, so it cannot pump up blood into the bloodstream. And then we have backup of the blood into the lungs. Once our heart is unable to pump the blood properly, it will cause problem to the heart valve. So this is the continuous from heart valve problem. So once your heart valve having problem to ensure the blood flow one way. So it will cause the backup of the blood into the lungs. Factors lead to the cardiomyopathy disease. For example, we have family history of cardiomyopathy, heart failure, or sudden cardiac arrest. So if you have family members who have this kind of history, which is cardiomyopathy, heart failure, so it is not impossible for you to have this kind of disease also, because it can be inherited. Long-term high blood pressure, so conditions that affect the heart, including a past heart attack, coronary artery disease, or infection at the heart, such as ischemic cardiomyopathy, obesity, cardiomyopathy patients. First of all, we have ventricular assist device, or known as VAD. It is some type of mechanical circulatory support device. Next, we have implantable cardioverter defibrillator, or known as ICD. It is implanted in the chest to detect or stop abnormal heart arrhythmias. Next, we have pacemaker. We have septal myectomy. It will cut a little bit your heart tissue and it will be removed. Therefore, you will create a lot more space for your blood to enter. Last but not least, we have heart transplant, but this only for critical condition. The patient has to go through a surgery where we replace the heart with the new one, with the one that is healthier and better.
Hello everyone, my name is Melinda and I will explain about the broken heart syndrome. A broken heart syndrome is a temporary and irreversible heart condition whose symptoms mimic those for a heart attack. Unlike a heart attack, broken heart syndrome happens when a sudden physical or emotional stress causes a rapid weakening of your heart muscle. Who gets broken heart syndrome? Broken heart syndrome mostly affects humans, about 88%, especially in later middle age after menopause, means age range 58 to 77. One possible explanation is that the female hormone estrogen protects the heart against any harmful effects of the hormone released in response to stress. As the level of estrogen declines with age, humans might be more susceptible to the effects of the sudden stress. What causes broken heart syndrome? The exact cause of broken heart syndrome is not fully understood. When you react to the physical or emotional stress, your body releases stress hormones in your blood like adrenaline, noradrenaline, epinephrine, norepinephrine. Experts think that these hormones temporarily interfere with your heart functions. Broken heart syndromes can be effects by disrupts your heart normal, steady rhythmics, pattern of heartbeats, causes part of your heart to temporarily enlarge the lower part of your left ventricle, and leads to even more forceful contractions in other areas of your heart. These changes causes temporary heart muscle failure. What are the symptoms of broken heart syndrome? We can feel symptoms within minutes up to hours after the stressful event. In broken heart syndrome, the release of stress hormones temporarily stunts off your heart muscles, producing symptoms similar to a typical heart attack. Signs and symptoms of broken heart syndrome include: the first one is sudden, the second one is shortness of the breath, a main symptom, weakening of the left ventricle of your heart, a main sign, fluid in your lungs, irregular heartbeats, and low blood pressure. A small percentage of the patients diagnosed of the broken heart syndrome cannot identify any stresses that may have triggered their episode. How is broken heart syndrome treated? Treatment depends on the severity of the symptoms. Broken heart syndrome is usually treated with the medicines until fully recovery. Medications include: the first one is ACE inhibitors to lower blood pressure, is long-term. Beta blockers to slow the heart rate is short-term. Diuretics to decrease fluid build-up, short-term. And anti-anxiety medicines to manage stress. These medications may be long-term if needed.
Hi, Assalamualaikum. My name is Siti BALQIS binti Abdul Wahab. So today I'll be talking about the disease that related to the cardiovascular system. So we have the heart failure. So what is heart failure? Heart failure is a chronic progressive condition in which the heart muscle is unable to pump enough blood to meet the body's need for blood and oxygen. So the part of organs from the system that affected by the disease is the heart. So the heart will be facing severe problems like the heart valve problems. So, for the heart valve problems, the valve of the heart will keep the blood flowing in the right directions, but due to the heart failure, it may not work properly if the heart is enlarged or if the pressure in the heart is very high. The function of the system and how it is affected by the disease is: the function of the system is to transport oxygen to individual cells throughout the body. However, due to the heart failure, the heart become a weaker pump where it will be less effective at pumping oxygen-rich blood through the body. As a result, oxygen level will drop. When oxygen level drop, it is possible to become a short of breath. Then we go to the risk factor that lead to the heart failure. So the risk factor is actually high blood pressure or known as hypertension. The high pressure in the blood vessel causes the heart to pump harder than normal in order to maintain the blood circulation. This takes a toll on the heart. And over the time, the chamber get larger and weaker. The available treatment for the heart failure disease is for the first one is by medication, for example like ACE inhibitor, and the second one is by implemented device in the chest like pacemaker.
Moving on, we have heart arrhythmias. They're basically irregular heartbeats. They occur when the electrical signals that control the heartbeats don't work properly. Heart failure and blood clotting issues may come from an arrhythmia that causes your heart to pump inefficiently for an extended period of time. Blood may clot if the heart is unable to pump it out effectively, which would then block an artery and prevent blood from reaching the heart, brain, or any other vital organ. Heart failure can develop if an arrhythmia causes your heart to pump ineffectively for an extended period of time. Okay, there are two types of arrhythmias. First, we got tachycardia. There are four main types of tachycardias. Atrial fibrillation, ventricular tachycardia, and supraventricular tachycardia. The other one is bradycardia. The other type of arrhythmia is called bradycardia. It has two main types: sick sinus syndrome and atrioventricular blocks or conduction blocks. Okay, moving on. Here are almost all of the symptoms of heart arrhythmias that you can have. Firstly, we got fluttering in the chest or chest pain, dizziness, shortness of breath, tachycardia, and bradycardia. To be able to diagnose an arrhythmia, doctors may use these devices: an EKG, which is an electrocardiogram. It records the electrical activities of your heart. An ECG, an echocardiogram. It uses ultrasound to check your heart muscles or valves. An implantable loop recorder, which is implanted under the skin, and it constantly records your heart's electrical activity. Finally, we have the Holter monitors. It's basically a portable EKG you can put in under your skin for a short period of time. Then you can go to your doctor and he can download the results. Here are some risk factors that you need to know. Firstly, we got high blood pressure. Secondly, excessive alcohol consumption. It can affect your heart's electrical impulses, increasing the risk of developing atrial fibrillation. Caffeine and nicotine can make your heart beat quicker, potentially leading into dangerous arrhythmias, especially if you're overweight or obese. To wrap things up, I have a few points to make. The circulatory system works thanks to the constant pressure from the heart and valves throughout the body. Regular physical activities is crucial for maintaining your health, and regular exercise can also prevent or delay the development of high blood pressure in people with hypertension and any other heart disorders, as well as other conditions. That's it for our group. Thank you for listening, and if you want to look at our references, it will be in the next slide.
These are the references from our group, and that's all from us. Thank you for watching.